Hi, it's Rod Rohrich, a special Rohrich Knows podcast. The eye only sees what the mind knows, or things I've learned in plastic surgery. Some of them are PG and some are not. So I've got Tabbal with me and Jamal Ahmad, and these all have been my students, and now they're actually been teaching me a lot of stuff over the years, sometimes, but it's been great. And so I'm going to start with you, Gio.
Yes.
So tell me about what you've learned in plastic surgery that's changed your life.
Well, there's so much because
He's a New Yorker, you can tell.
I'm a New Yorker, and that's still in me. You can't get it out. But here I'm in Texas, and I think it's important to remember in any type of medicine, especially plastic surgery, if you're lucky enough to be, let's say, successful, you have to remind yourself that the 1,000 in the first procedure you do doesn't give a hoot about the first 1,000. In other words, each patient that you're operating on, what you do in that outcome has no relationship based upon your success previous to that day. So, I remember Conor McGregor has a great quote that every day he wakes up, he's a white belt, he says. And
Did he really say that?
He really said that. No, the humility, he's very cocky. But
in real life.
In real life, to get to that level, he had to be humble. And that's unfortunately what people lose along the way.
True.
But being humble, remembering what matters, which is the only thing that matters is the move I'm about to make, why I'm making it.
Yeah. Well, it's like you say, you're only as good as your last case.
You're only as good as your last case, and it can always be better. I mean, the people around you, I remember you telling me this, the people around you are buttons of an elevator of your life. They'll bring you up, or they'll take you down.
Yep.
So you want to be in a room in which people are much better than you. They have
100%.
something that you need, and that will ultimately, you'll end up within 10% of usually whatever parameter of thought you want to consider. So
yep. Yeah, you never want to be the smartest person in the elevator or in the room.
Or in the room.
Because if you are, you need to get off the elevator.
Correct.
I agree.
Yeah.
Jamil, you agree with that?
Yeah, for sure. I think there's a lot of insight in that. And, following on that theme, I think, both of us have had really the honor and the privilege of having great mentors who have become great friends over the years. And when you look at people you really admire, people you think are at the top, the pinnacle, the top of the mountain, who know everything about everything, and they still approach things with that humility, with the respect, right? They know that there's still things they don't know.
I remember Dr. Rohrich, he came in one day when I was a junior resident, and a patient came in for some I forget what reason, in the middle of the night, and I had to call you, and you jumped out of bed, came there. I remember when she was getting in bed, you took her pillow and you fluffed it as she got into the bed. And my eyes did a little bit of like one of these, as if like we worked at a hotel. But he was so caring, and because he said, anybody can be a plastic surgeon, but only, I can make anybody a plastic surgeon, but only your mom can make you a doctor. And
Yes.
I think that's so true, that what matters really is yes, you are important, but the patient is what matters. And
Yeah. Well, you got to be a good person first to be a good doctor. So.
And, the greats really have a lot of humility. They're experts. They know so much. But I think the most important thing that the greats, Rod being one of them, have learned is that they'll never know everything, right?
Yeah.
So they approach everything with that humility. And, we've had the pleasure over the years of learning from you. And I think that sets a great example for us.
Can I add one last thing? I remember just the ability to pass things on. I was so fortunate, and I truly won the lottery to have been a resident at UT Southwestern. That really had much to do with your decision and Jamil's, respect when I met him as a junior medical student. And I just think that for someone of such promise, take the time to care, to listen, to look around them. The things you do will have an impact on the world that you'll never quite understand. And I have so much to give back to both of you. And you just felt like I remember thanking you and thinking, these guys just are just saying, oh, no need, no big deal. So,
yeah. Well, it's the little things that matter in life that are really important, and they matter to each of you, they matter to us, and they matter to our patients. I mean, I think there's so many things that sometimes patients will say to me, and it's really about the team. They'll say, wow, your nurses were so good when they took your stitches out, versus, versus, that, oh, they lost my car in the valet,
Yeah.
And, but all that makes or breaks you. And I think, it's the little things that matter. It's being around great mentors. We've all had great mentors. I had Jim May, Steve Mathis, and Dr. Dingman, and all these wonderful people. And the goal for us is just to pass it on.
Pass it on.
We've got to pass it on, because if you don't,
You die with it.
we die, and our specialty dies. And I think that's the great thing about what we do and who we are. So I think that the take-home message is that, you got to give back. You're going to receive a lot, but you got to give back a lot too. So what are some comments that you would make to people that, aspire to be like each of you?
I think that having good core values, being a good person, trying to do the best for not only yourself but those around you, is really important. I think working hard, right, having gratitude for the opportunity, those are the things that's a universal language. Good people recognize good people.
Jamal said this to me as a resident. He says, buddy, you might be tired, but remember, you get to go home at the end of the day. The patient still stays in the hospital.
Right.
And that hit me like a ton of bricks. Just you could complain as much as you want about how tough your day was, but he reminded me, he goes, you get to go home. Look at you have good health. That's all you need, buddy.
That's so true, and and I think it makes you a better you. I mean, I think when you do that, it makes you a better you, and I think when you're a better you, it spreads like wildfire, and I think that's really one of the most important things, and not only giving back, but learning one new thing every day is really, really important. So,
I have two great stories. Things I've I've seen, and they're not some of the other stories to bug you on your birthday, but I remember when I was a chief resident, there were so many greats in aesthetic surgery still in practice here. Fritz Barton, Sam Hammer, John Tebbets, Jack Gunter,
right.
And we had that opportunity to go and visit and spend time with them. So, I went to visit Jack Gunter, who arguably is the father of modern rhinoplasty.
Right.
He really changed everything we do about that operation, and
He made us talk about it.
Here he is in the twilight of his career, like literally the last 3 years of his career doing a primary rhinoplasty, and everything was going perfect. And there was one little thing about the lateral cruce he could not get right, and spent 2 hours to make it perfect, right? And it really was so humbling to watch that. And then fast forward a decade later, I'm at Baker Gordon, and Jim Stuzen's always been really kind enough to have me in the operating room to help coordinate. And Daniel Baker's doing a facelift, and Rod is the moderator because he's going to operate after. So, and I have this amazing picture where Daniel's doing a facelift and he's pointing, and Rod's right over his shoulder. And I was there for the conversation, what they were talking about the lateral platysma, right? And Rod being, I think one of the people who knows the most about plastic surgery is there with his ears wide open, listening to what Dr. Baker is saying, right? And so you see these two amazing people at their prime, and they're still learning, right? And it's so humbling to have those experiences to see it.
I remember Dr. Rohrich, I think you said this to me. I remember my cousin did that. You have 2 ears and 1 mouth for a reason. But it's true.
Yeah.
I mean, you should be listening
wisely.
Because when you open your mouth, the world, you tell the world who you are.
Yeah, no, I don't. But it's good to listen. All right, wise words. Give us your comments and thoughts. Enjoy.